Healthcare is an easy one. There's probably nothing that's more central to somebody's sense of well-being than their own health, their
It's
family's
literally
health.
life and death.
Yeah, so you want a healthcare company that you can trust. You trust their judgment. You trust your doctor, all right? Most people trust their doctor. You want a healthcare payer. You want the insurance company you want to be able to trust the insurance company like you trust your doctor. You don't want to suspect that the insurance company is saying this isn't covered this way in order to cover their financial benefit. You want them to
You want to
worry
make
about
sure that they're doing a reasonable job looking out for your best interests and your wellness and what many of those companies now are starting to think of as patient outcomes. So we've seen several companies starting to do this. Cigna in the United States, we actually worked with them. One of their very first steps when they were starting to try to move toward this greater level of trust with customers was simply to clean the language up. Let's take the customer's perspective by first using the language that customers use. So as it turns out, there are 240 words that customers use that are different from the same idea.
They don't use words like payee and payor. Okay, they don't use words like that.
That's right. And they don't. And you know, they don't like to say healthcare provider. Customers like to say doctor or nurse.
Yeah.
So one of the most important ones was just this whole idea of what kinds of things are going to be important. And what they decided to do was just put these 240 words off a list. I mean, you can't use them at all. And if you and I both work at Cigna, and you use one of those words, then I say, hey, you messed up, you know, and you're going to give me $1, we're going to put it in the kitty, and they send it to charity at the end of the year. But they cleaned it up. Now, when they did that not only had a benefit to the customers, it had a benefit internally because now we're thinking of customers, we're reminding each other how to take the customer's perspective.
It's a cultural issue.
Right, and so, but there were also some pretty dramatic results. So you had 5% greater understanding of the calls that were handled on the first call, 6% of the reduction in the cost of handling those calls. But here's the real kicker, 156% increase in the level of understanding by customers of how Cigna's business works. So we're going to take the time to understand you better, and that will make it easier for you to understand us and why sometimes we can say yes and sometimes we have to say no. And so we become more collaborative instead of belligerent. So that's really an important example, I think. There's another one in South Africa, the Discovery Group, and that group, their whole objective in life is to make customers well. I mean, they're all for rewarding organizations for the outcomes, patient outcomes, not just activities. And they actually will do things like this. If you're one of their customers, if you buy health insurance from them, they will offer you a program where they will pay for your gym membership if you'll use it twice a week. If you stop using it twice a week, then you get to pay for it. They will pay for you to have certain preventive measures, and they will reward you. You get to pay a lower fee if you weigh less, and if you've had your vaccinations, and if you've had your flu shot, and if your kids have had their vaccinations. And their goal is to make you healthier, make your family healthier, and make the whole community healthier. And that's in their best interest as a business, and also in everybody else's best interest.
Let me give you another quick example. There's good research that says that the single biggest factor behind a malpractice suit, successfully prosecuted. The successfully prosecuted malpractice suit, the single biggest factor is bad manners on the doctor's part. It's not incompetence.
Being brusque.
Being brusque, bad bedside manner. What that really means is, even if you make a mistake with a patient, if the patient likes you and trusts you, he's not going to sue you. Mistakes are inevitable. People make mistakes, and you can be forgiven for making a mistake. But if you're a brusque, mean person, you don't have good manners, I'm going to sue you. You made a mistake. And a trustable healthcare company will train doctors in their mannerisms and the way that they handle patients and the way they relate to patients and the way they gain a patient's trust and confidence, not just because it's good for the patient, but because it's good for the business as well.
We predict a day when malpractice insurance companies will actually come and evaluate how good a doctor's credentials are, but also how good her way of carrying.
Maybe her net promoter score. Maybe they'll look at her net promoter score to set
Angie's
her
List
malpractice
ratings.
rates.
Right.